He swore at me, he spat at me, he pinched me, he punched me, he kicked me, he burnt me, he cut me, he raped me, he underestimated me.
I didn't know what WRSAC was or an IDVA was, or I didn't know how social services worked in the court, and you kind of plunged into that, and it's really frightening. People say, oh, battered women and that. Actually, that's the least of your worries. When the medical stuff and the police stuff is over, the police go, thanks very much, and then you're like, what do I do now?
And it started off, you know, they love you and you're the best things, you know, you're theirs, and in some respects that's nice to feel loved that much, that, you know, and then of course, you know, you get a few little slaps and then you're like, you're the one that's apologising. But even when he started abusing my kids, his own child, and there was nothing I can do.
We'd been delivering services across Cornwall to women and teenage girls who'd experienced all forms of violence, sexual violence and domestic violence, for many years really. But we weren't actually getting referrals from hospitals where we knew that women would be presenting.
I think in the past, part of the lack of confidence of staff was that not even if we asked about it, we didn't have a secure way to refer on to appropriate people, and now we do have that. So the patients are going to get a more immediate response to their cries for help.
I didn't tell anybody the situation I was living in for 7 years. I put up with it. And if I'd known sooner that just saying a couple of words would have got me the help, I could have been different a long time ago.
And there are major health inequalities for women that are being tackled effectively by this service here in Bodmin.
Pattern changing is a really exciting project. It's a 14-week programme, and in that time women are able to look at abusive patterns that have happened in their lives. So they're able to name their abuse, sometimes for the first time.
The first time I cried in public was in the first pattern changing meeting, and now I just can't stop. Really works, it really is. It's liberating, really liberating. So yeah, brilliant, really good. So using it in everyday life now.
I established a group specifically on domestic violence, and my main advisors came from this service, and that has helped us not only develop our policies but to influence practice by front-line NHS staff.
I think people think that Cornwall is this sort of wonderful, idyllic place to live, but actually, you know, we have massive social deprivation here. Women sometimes travel 120 miles round trip to get to us, and that's a testament to how committed women are to heal and to move forward in their lives.
I'd be sitting here crying. Truly I would be, but I don't need to anymore. Taking my life back because they've helped me.
It's given us all a little bit more ability to go out into the world and not be frightened, not just of our abuser, but of society in general, of how to integrate back into it and be somebody who is worthy of respect and is worthy to have the views heard.